As a DA2 or a CDA here in North Carolina, you can provide a service of coronal polishing to your patients. If we look at the picture above, this is what we will use at GTCC for coronal polishing. Let's take a look at our instrumentation and our supplies needed. We will need our exam kit, which should have the following inside: a mirror, explorer, cotton pliers, articulating forceps, and air water syringes with cotton products that have been sterilized. You will need a polishing cup, a bristle brush, a Profi grip. You will need polishing agents. You will need a Profi slow speed handpiece, floss, saliva ejector, HVE, and 2x2 gauze that have been sterilized. As we set up for our room, we will also use infection control barriers to go over our Profi slow speed handpiece. This should demonstrate how your handpiece should look like as the barrier is placed. You need to make sure that the Profi angle is placed onto your slow speed handpiece properly, and check this prior to seeing your patient to make sure that it is secure. It will not come off of your slow speed handpiece once you're with your patient. Listen carefully for 10,000 RPM. Here is a demonstration of one of the Profi agent grips that you can use. This is the second one that is available here at GTCC that you can use as well. After our patient is seated and everything has been explained to the patient, and we have inspected the oral cavity, we will apply disclosing agent to identify areas of plaque. This is the type of disclosing agent used here at GTCC. The polishing cup should be full of polishing agent, as seen here. With your polishing paste inside your Profi cup, you will spread the agent over several teeth, 3 to 4 teeth, and then begin with polishing. You will begin with the distal most posterior surface. You will establish your fulcrum and place the cup in contact with the tooth. The stroke should occur from the gingival third toward the incisal third of the tooth. Using the slowest speed, apply intermittent strokes with the revolving cup lightly to the tooth surface for approximately 1 to 2 seconds between strokes. Use intermittent pressure that is significant to cause the edges of the polishing cup to flare slightly. Each tooth should be completed in approximately 3 to 5 seconds. Here is an example of your polishing cup being flared with pressure. Depending on your positioning and where you are in the mouth, you will need to use indirect vision and establishing your fulcrum in different areas. Here's an example of this. Here is another example of establishing your fulcrum and using indirect vision. If you can look closely, you can see the reflection of the light in the palate of the dentiform. When it comes to the occlusal surface, you will use the bristle brush. This will help remove stains in the deep pits and fissures of the enamel surfaces. You will apply a mild abrasive agent to the brush and use light wiping strokes. Spread the polishing agent over the occlusal surface to be polished. Use the free hand and fingers to retract or protect the cheek and the tongue from the revolving brush. You can also use your mirror for this. Establish your fulcrum. Bring the brush almost into contact with the tooth surface before activating the brush. Using the slowest speed, apply the revolving brush lightly to the occlusal surface. Take care to avoid contacting the gingival. Use short stroke brushing motions, moving from the inclined planes to the cusp of the tooth. Move frequently from tooth to tooth to avoid generating frictional heat. Here are some things to remember while coronal polishing. 1, your mirror positioning. 2, your operator positioning. Your dental anatomy, your fulcrum positioning, and your instrumentation. Also, always remember to replenish with polishing agent as much as possible. During the procedure, you will rinse your patient when the patient is needed or after every quadrant.